It's very important to keep the implant fully deflated at all times after the surgery, because the human body creates scar tissue around the different parts of the implant. So the reservoir has to be maintained full so that it can store fluid well. Otherwise, fluid will be pushed into the cylinders and the patient will complain of autoinflation or spontaneous inflation. Likewise, we want to start inflating early, because if you don't, then scar tissue forms around deflated cylinders, and then you can't get the fluid into the cylinder later on when it's healed. Now, in order to be able to inflate, deflate, the patient has to be able to feel the different anatomical features of the pump. You need to be able to feel the deflation button. You need to be able to feel the bulb of the inflation portion of the pump. So it's very important to be in bed for 2 days after the surgery, so that the scrotum will not swell, and then you'll be able to inflate and deflate very early. Now, my job, my responsibility is to make sure that there is minimal dissection, adequate positioning of the pump, and no bleeding around the pump, so that this will be facilitated for the patient.